Hello and welcome to today's Here's to Your Health podcast. I'm your host, Don Lensman. My guest on the podcast today is Cyilee Martin. Cyilee is a nurse practitioner here at CCMH seeing patients in our medical clinic. And Cyilee, thank you for your time today.
Of course.
I appreciate it very much. So Cyilee, you're relatively new, been here since last November. It's taken us a while to get around to this, but so let's do this. Let's introduce you to the community for people who maybe don't know who you are or how you got here. Who's Cyilee Martin?
All right. Well, my name's Cyilee Martin. I am fairly local and from the Avoca area because people do ask that quite frequently. I've been a nurse for 15 years. Most of my nursing background is in emergency medicine, but I did do a variety of things with nursing, including hospice and family practice. I've been an NP for the past 2 years, and I graduated from Creighton with my doctorate. My first year, I did some cardiology, inpatient over in Council Bluffs. Following that, I did mental health for a little over a year, and now I'm here with you guys.
So let's go back for just a minute and talk about your nursing experience, because I would think that that really informs how you deal with patients that you see in the medical clinic who come in with acute conditions.
Yeah. Having been a nurse for 15 years really did help broaden my knowledge, especially the emergency department. Doing acute care and emergency can be very similar in a lot of ways. So I have a good idea of where people start with certain things when you come in with a condition, kind of what to start with and where to go from there, and also just getting to know the patients. And I like to provide like patient-centered care, so I like to give a lot of education to patients as well when I see them, and allow them to kind of help guide their healthcare using my knowledge and skills. So.
Part of the reason we're doing this podcast today is to set the right expectation for people when they call for an appointment, because if you're sick today and you call for an appointment, chances are they're probably going to get you, because you are literally not building your own practice, but you are just seeing, for lack of a better term, sick patients.
Yes.
So tell me how that works.
So generally speaking, I see patients mostly same day. However, sometimes there are people already on my schedule that have been overflowed from the previous day, unable to get into their provider. I have seen already, I've been here for about 6 months, so I've seen already several people multiple times within their family members, which is nice. They said it's very nice to have one person they know outside of their primary to get to come see that same person and know who they're dealing with every day versus bouncing around to whomever else may be open. So kind of filling that gap for when their primary is full, but they really need to be seen kind of sooner rather than later. So that's where I'm at.
My guest on the podcast today is Cyilee Martin. Cyilee is a nurse practitioner provider in our CCMH Medical Clinic, handling same-day and overflow appointments. And we're talking about her practice and how she's grown into that here at the hospital. Cyilee, when it comes to maybe what I need to do first is just explain quickly that there are only so many providers and only so many appointments, and to demonstrate, sometimes I realize the frustration that patients have when they call. We have about 200 appointments. We have about 200 people that we can see in a day in the medical clinic, and yet there are some Mondays when we'll get 400 phone calls. Not possible to see everybody. Nonetheless, when people call, I realize that they're not feeling well and they really want to be able to see somebody right away. The key to this whole thing is to understand that we have someone who's dedicated specifically to see nobody but sick people, and you happen to be it.
Yes.
So tell me about what excites you about coming to work every day. What excites you about being involved in primary patient care?
The number one thing I like about doing what I'm doing now is the ability to kind of help people in that time of need when there is no one else to do it. It is very nice to be able to come in here and see a patient and send them on their way with them feeling better, within a day or two of coming in, hopefully. The other thing that I want to mention is that I also come in 2 days a week at 7:30. A lot of people don't know that someone's here that early. So 2 days a week I am here earlier in the mornings. So if you can get those appointments, that's helpful too for people that, maybe were woke up in the night and they were sick and want to be seen right away, I'm here for those. I think, yeah, it's exciting to get to be in a rural community. I'm from rural health. I like taking care of, small town people, very used to the environment and the lifestyle and kind of expectations that come with living in this type of community.
What would you say are the biggest challenges that you face with walk-in and same-day appointments?
Complex medical histories, having short time to get to know all that depending on the severity of what they're here for. Cough and cold, that's one thing, but sometimes it's a little bit more than that. And the time constrictions kind of on seeing some of those people. I do try to, if I see something that looks more complex, have the front extend the time so that I have plenty of time to look over and take care of each person, and I do a pretty good job of that. The nice thing about being in the same place as their primary provider is they are easily available for me to come walk over and say, hey, I got this patient of yours and this is what I was thinking. And everyone here has been very receptive to that, and I do think that's the benefit of having me here versus going somewhere else where your primary is not, is they are available to me.
And there's another little known aspect of healthcare that I think most people are not aware of, and that's the collaboration that most providers have with one another. And you just touched on that. I don't know if you can explain it more fully, but I think the ability, almost like a brain trust, to sit and talk about and brainstorm potential issues and solutions, I think would be extremely helpful.
It is, and I think a lot of people are nervous to not go to their own primary care because they don't know them, which again, like I say, a lot of their providers are here, and if I have any concerns, I do bring them immediately to their own provider so they are aware, and that's the benefit of having someone that does just those acute care visits in the same facility.
My guest on the podcast today is Cyilee Martin. Cyilee is a family nurse practitioner provider here at CCMH in the Medical Clinic. We're talking about her practice, which is entirely same day and walk-in appointments. Which is important, especially when you have so many people who are sick all the time. Maybe one of the things that I'd like to ask you is what do you find that's been the most surprising about what you've been doing since you've been here?
I think that in rural health, the same day visits become a little more complex than what they would be in standalone urgent care. The nice thing I think is being connected to an emergency department if I need to refer there. Sometimes people come and want to be seen here and need to be referred over, and that's beneficial too. But yeah, I think the surprising part is probably sometimes the complexity of the people that come in same day, but the benefit is the ER and their PCPs being present.
And knowing that you've got so many different people coming in on a daily basis, what can patients do to help themselves? I mean, in other words, I guess what I'm saying is that knowing that we have so many people who are sick, what can patients do to be more proactive about taking care of their own health and maybe cutting down on some of those visits, trying to be less of a user of the healthcare system?
I would say number one would be those follow-ups with your primary care provider, especially for any chronic care visits. I know a lot of times those get kind of missed occasionally as people are out the door, but maybe getting those scheduled in advance on their way out after they've seen their primary and doing their regular checkups. Obviously, hand hygiene during the sick seasons is incredibly important and helpful. But those are some of the main things I would say, just kind of stay on top of your health care.
And I think that's what's really important. And that would include things like regular routine screenings.
Yes. Mm-hmm.
So colonoscopies, mammographies.
Just regular lab work, that they get yearly as well. But yeah, all of those things are beneficial in catching things early and, maybe not having things get to the extent that they have to be seen urgently.
Which, by the way, we do have a wellness event coming up in June 17th and 18th, a Tuesday and a Wednesday from 6 to 8 a.m. both days. So if someone would like to come get some lab work done, we can do that. $45 is all it costs. You can go out to our website at ccmhia.com. You can sign up there for our wellness event. Cyilee, thank you so much for your time today. I appreciate that.
Yes, thank you for having me.
My guest on the podcast today, Cyilee Martin, a family nurse practitioner here at CCMH, working in our medical clinic, taking same-day and overflow appointments. If you'd like to make an appointment with Cyilee, you can do that at 712-265-2700. And we would love to have you come see us and her. I'm your host for the Here's to Your Health podcast, Don Lintzman. Thank you for joining us today. Have a great day.